are going squirrely, stuck inside their homes. Businesses are collapsing. As the Prime Minister said, a vaccine is what, 12 to 18 months away? So is there a way back to some semblance of normality before a vaccine? The answer is three words: testing, testing, testing. And there may now be a breakthrough on that, a new tool to fight COVID-19, and it's Canadian-made. Health Canada has just approved something called the Spartan Cube, a portable rapid test made by an Ottawa-based company. Chief Public Health Officer Theresa Tam already has plans to send the device to remote communities. Check this out.
Because they are more portable and they can be used nearer the patient, if you like, and they are quite rapid in terms of the turnaround time. The idea, I think, is to prioritize these to more remote areas that have less access to the more central laboratories, so that it would not require any transportation time for the specimens to be sent.
Okay, so how does the Spartan Cube work? What makes the new test so important, and why have so many provinces rushed to order it? Let's find out. Joining me now is the Spartan Bioscience CEO, Dr. Paul Lem. He's in Ottawa, and I spoke to you earlier today, Doctor. Great to have you on this program. Tell us how the Spartan Cube works differently than the standard COVID-19 test.
Hi, Evan. Thanks for having me on your show. So the standard COVID-19 test is you take one of these swabs, then you have to ship it off to a big lab in a city like Toronto that has mainframe DNA analyzers. Then they have to run all these samples together, report the results back. And so that's why it can take days or even over a week to get results. So in contrast with our portable COVID-19 test, you take that swab, you put it into this test cartridge, put it into our device with the size of a coffee cup, and then you get your results right away.
Wow, so you described it like one of those Keurig kind of coffee things. So this was originally for DNA, and you reconfigured this for COVID-19. So my wife had the test. It took 13 days to get the results, doctor. But the swab was really deep up. You have to go right into the nasal cavity. It was quite uncomfortable. So is yours the same?
Ours is different. So we have Health Canada approval where you can take the swab in just the front of the nose or the back of the throat. So it's much easier to do.
Okay, and so these kits, you've just made these things. How quick was the approval process? Did Health Canada basically make an effort to fast track it?
Definitely. We were very impressed with how closely Health Canada worked with us. So over the course of the last several weeks, we've been submitting data to Health Canada, and they gave us approval on the weekend.
Dr. Lem, how fast can you produce these Spartan Cubes? Like, give us a sense of the demand you're getting.
The demand is unbelievable. So just even outside of Canada, it's foreign governments, foreign corporations are trying to get all of our supply. So we've turned them all down, and we're prioritizing Canada. And in terms of ramping up, so we started shipping today, and we're going to ramp up to hundreds of thousands of tests per week by the summer.
Wow, so you've turned down results from around the world. Like, you've been bombarded with requests from other countries because everybody's dying for this quick test. Is that it? And you're saying no? So how many can you produce for Canadians, and how fast?
So we're going to produce several 100,000 tests for Canadians per week, and that's going to ramp up from now until the summer.
Doctor, who can get these tests? So is this for doctors, for, I don't know, we talked about long-term care, or is it for families? Like, will everybody have a Spartan Cube test?
So the first phase is we are shipping to the federal and provincial governments, and they will decide where they want to allocate these tests to. I think the next phase will be Canadian corporations. So again, every single day we get bombarded by requests from corporations because they want to test workers so that they can get back to work. And then probably there will be a last phase. Our vision was always, how do you bring this to everyone?
Doctor, how much does one of these cubes cost?
So I think the province of Alberta disclosed their contract, which was they ordered 100,000 tests and 250 of the devices for $10 million.
Okay, so they're not cheap to do, but you're able to do it. And people want to know, does it actually work? Does it screen, for example, asymptomatic people? Does it screen to prevent the false positives and false negatives we've heard about?
Yes, this is an extremely accurate test. So we took the CDC's validated test that they tested on over 2,000 respiratory clinical samples at 100% accuracy rate. We took the CDC's test and we put it onto our device, that our technology been selling for 14 years around the world. We have, for other commercial tests, top-tier customers like Mayo Clinic, CDC, and New York State Department of Health.
So, Doc, just before I let you go, I mean, this could be the way back to some normalcy normality before we get to some kind of vaccine. Let's say the virus mutates. Could these Spartan cubes then test for something else?
Definitely. So you use the analogy of the Keurig coffee machine. So once you have the device, then our company is able to rapidly make a new pod. So let's say COVID-20 comes out, and we can make that new test, and then everyone who has the existing device will be able to use it.
It's remarkable. It's Canadian. We wish you the best. Your innovation is awe-inspiring, Doctor. We wish you and your team, I'm sure you're hiring like crazy right now. Keep producing them. We need them. Dr. Paul Lem, sir, thank you so much. Appreciate it.
Thank you, Evan.